everybody, this is Jarrell Krilich, Frisco Fit City Ambassador, welcoming you to this edition of the Get Moving Minute. You know, these last few years have been amazing. This journey to become a health coach and to develop a private practice and to specialize in diabetes prevention and to work with well over 100 clients in this past year and have amazing outcomes, even though we were having to facilitate via telehealth, which was a different way than we've done in the past, has been amazing. I have really exciting news. You know, mark the date. Today is May 22nd, 2021. And today's the day that I figured out exactly how I'm going to be able to reach as many people as possible. Because if you've been following this podcast at all, you know that my mission in life is to help as many people as I possibly can with this information, with the process of health coaching, because we don't have to fall into the sick zone. We don't have to, it just doesn't have to happen. And I'm just so passionate about helping as many people as I possibly can, who have struggled, not for lack of trying, to get healthy, stay healthy, and to ensure that as we age, we can do it healthfully and we can avoid all of these chronic conditions like diabetes, like heart disease, like cancer, kidney disease, Alzheimer's, etc. So today's the day I figured it out, and I just wanted to share the date with you guys, so more information coming soon. I am going to be putting my diabetes prevention program here out on the podcast, and I'm going to create episodes for you guys, and I'm going to share them here, and they will live here in perpetuity. So that's going to for sure be one of the ways that I'm going to make it accessible to everybody. Now, unfortunately, in a traditional diabetes prevention program, you have access to a live lifestyle coach, either via telehealth sessions or in a group via telehealth or a live workshop, which we were doing prior to the pandemic. So please know that at any given time, if you're interested in learning more about that, you can visit my website at friscofitcity.com. Okay, so if you're wondering about diabetes prevention, what is it all about? You can also find out more about that on my website. But basically this diabetes prevention program, we call it Prevent Type 2. It's part of the National Diabetes Prevention Program. It's a partnership with some public and private organizations which are working to help people prevent and delay type 2 diabetes. And what we're doing basically is working with you to make sustainable changes to your habits to help you lose weight, feel healthier, and lower your risk of developing type 2 diabetes. Look, as a health coach, I know making these changes is hard to do, especially if you're trying to do it all at once. That's why this program is designed to last for a total year. And I know right away you're thinking, oh my God, a year? Let me break it down, okay? First of all, think about the year as 24 sessions. So when you think about the 24 sessions, think about 24 hours. I mean, do you have 24 hours that you could spend to improve your life for the rest of your life? Think about it. Okay, let's break it down. The first 16 weeks of the program, you're focusing on learning how to make changes to your activity level and some changes to your nutrition. But we're using some realistic strategies to build new habits each week. And we're not trying to do them all at once. We're doing 1 or 2 things a week. We're going at a pace that works for you, okay? And we're going to tailor that to what you want to work on first, what you feel like is the most important, okay? So that's the first 16 weeks. The rest of the year, we're going to focus on helping you to maintain those habits and keeping up with the improvements that you've made. So let me tell you, there's some science behind this, guys, all right? This program was modeled off a large study that compared a bunch of different approaches to helping people reduce their risk of developing diabetes. The original study compared 3 things: getting active, getting advice from your doctor, okay, or taking fake medication. That was in the study. The next one was getting advice or taking real diabetes medication. The third one was a program like this designed to help people change their habits. And what do you think happened? Well, the people who did the program like this, we call it a lifestyle intervention program with a coach, lowered their risk by a lot more than those who were only given advice. Basically your doctor telling you, hey, you need to lose weight. Hey, you need to get active. Hey, you need to make some changes. Okay? More so than getting advice or taking medications. In fact, they were able to cut their risk of diabetes in half. That's right, in half. What's more, they also kept their risk lower over the long term. 10 years later, those who actually finished the program, stayed engaged with the program, did the program, were still a third less likely to have diabetes. That's the power, guys, of changing these habits, okay? But you gotta do it. It's a slow process. You gotta embrace that slow process. So let me break it down. What are we trying to achieve the first 16 weeks? Well, when we're doing something hard, it takes a lot of focus, and we got to do 1 or 2 specific goals at a time, all right? This diabetes prevention program has 2 goals to achieve by the end of the 16 weeks. We want participants to lose 5 to 7% of your starting weight, which is not a massive amount of weight, and we want you to work up to building 150 minutes of activity a week, working up to that. Now remember, these are goals for 4 months from now, so you're not going to hit them immediately. Your coach is going to work with you to break them into reasonable chunks, okay? We're not going to start out 150 minutes a week. And keep in mind that if 150 minutes a week sounds scary, it's 20 minutes a day, or 30 minutes 5 times a day, or 15 minutes in the morning and 15 minutes in the evening. Okay, what are we striving for? What's the long-term goal? Well, we're not done after 16 weeks. From there, you're going to keep these new habits over time, all right? The goal is to keep them by the end of the first year. We want to keep that weight off, okay? If we haven't gotten it off yet, we're going to keep working towards it, all right? And we're going to keep up that habit of 150 minutes of activity every week, because we know if you can do it for a year, you can do it for life. And we're going to support you in maintaining that progress, okay? We're going to keep these new habits going, and you're going to be able to keep working with your coach for a whole year. Okay, you're probably wondering, well, why? Why am I wanting to do this? Well, losing weight and getting active are 2 of the biggest things you can do to prevent diabetes. And guess what? It's the same prescription for heart disease, stroke, lowering your cholesterol, lowering your blood pressure. Same prescription. Okay, we know doing these things helps you stay healthy. As you probably guessed, meeting these goals are going to bring a lot of other benefits. You're going to sleep better. You're going to have more energy. Your mood is just going to be better. Your memory is going to be better. All right, and like I mentioned before, you're going to lower your risk of heart attack or stroke as well. We know. Okay, as a coach, look, I'm on the front lines. I'm working with folks every single day. Just like you, I know that these goals are hard to meet. That's why this program has been built to give you guidance, because we know it works if you have support from a personal coach. Okay? When we work together, when we get started, we're going to take some time. I have a really cool activity I'm going to ask you to do so that you can figure out your why. We know that participants need to feel like this is important for them to be successful. So we're always going to ask you, take a moment and think about why. Why do you want to prevent yourself from developing diabetes? Think about what matters most to you. Think about if you did develop diabetes, how's that going to impact the quality of your life? How's it going to impact your life? How's it going to impact the people that you love? And once you have a clear idea of what it is that you are trying to keep, what are you trying to preserve? what's most important to you about this process and making these changes? Write it down, okay? Keep it where you can see it, all right? Remembering this over time is going to help you stay motivated, all right? All right. You're like, okay, I'm a little bit interested. And look, guys, you're not alone. 1 in every 3 adults over 40, or really, no, it's not even that. It's like 1 in every 3 adults is pre-diabetic, and only 10% of them know. The rest of the folks don't even know, okay? So this is a struggle for most of our population, but good news is, guys, we can do this. We can do this together. We have the power to keep that iceberg under there, not from flipping over. Okay, right now we're the tip of the iceberg. All the folks that are pre-diabetic, all the people that don't even know that they're pre-diabetic, that are in danger of becoming diabetic in the next 5 years, that's the iceberg under the sea. That's what I'm working on. That's why I'm here. That's why we need to do this together. All right, here's the deal. We got a few different things going on with the program. We're gonna ask you to commit to tracking your weight and your activity time each and every week so that you can check your progress. We're gonna ask you to read your lessons. We got some little lessons for you to read. We're gonna ask you to read those every week. It's gonna focus on a specific area. These are gonna give you some helpful information, the real science, the evidence, not internet hype, specific guidance to help you make better food choices and to get active, okay? But the goals that you're gonna set each and every week are gonna be determined by you and your coach. And you're gonna talk to your coach. The coach is there to support you. They're gonna help you identify barriers to change, and they're gonna help you develop some solutions that fit for you in your life, because everybody's life is different, okay? The program, we're going to learn about, why tracking's important, why that matters, why it's important to do that, and we're going to figure out ways for you to track that work for you. All right? So basically every week, you got to check your weight, log it, track your activity, read your lessons, and chat with your coach. That's it. All right? The program only works if you can commit to doing these things consistently, all right? And trust me, the folks that stay in the program, that commit and engage, even if you've had a bad week, that's okay. These folks meet their outcomes and are successful with the program, all right? Most people, you can do this, you can fit it in with less than a couple of hours a week, okay? So if you decide to come along on this journey with me, these are your commitments, all right? So this is my session 0. I'm explaining to you guys a little bit how it works. You can follow the podcast because I'm gonna post a post just like this each and every week. We're gonna follow the lessons of the program here on the podcast, and we're gonna do some goal setting together at the end of each and every podcast, all right? So start thinking about the program if you wanna do it, and start thinking about how you're gonna track. Are you gonna use an app? Are you gonna get a notebook? I don't know. You're gonna check out some resources on my website at friscofitcity.com. Just something to think about. I want you to make a conscious effort to think about starting to weigh yourself and tracking activity each and every day. This is how we're going to start establishing this as part of your new routine, okay? This is what I want you to think about as your first commitment, all right? And then I want you to keep an eye out, follow the podcast, keep an eye out for the next lesson, okay? This is Jarrell Krilich, Frisco Fit City Ambassador, reminding you to get up, get out, get moving each and every day. Make it a great day. Congrats on making a commitment to improve your health. I'm so glad you're here, and I look forward to supporting you along the way.